I'm Dr. Lippy, and I'd like Dr. Barinholtz to discuss stapedectomy in the juvenile patient.
The juvenile otosclerotic that is generally considered under the age of 17, and one of the papers that was written in practice reviewed about 47 children, some with bilateral disease, totaling 60 years, and these children did quite well after undergoing stapedectomy. With regard to some of our other talks, we do try to do juvenile stapedectomy under local anesthesia, especially if they're over age 12. Probably under age 12, we'll have to do general anesthesia. These children did as well as the adults in general. However, all require a preoperative CT scan to make sure we're not dealing with an enlarged internal auditory canal or an enlarged vestibular aqueduct, particularly in the child that presents if he has an abnormal facial appearance with a widened intercanthal distance. The air bone gaps were as good as our adults.
Actually, in general, they're a little bit larger, aren't they?
I think that
Our average air bone gap, I think, is a little larger than an adult's.
Yeah, the presenting and the overall result, they did as well as the adults. The otologic surgeon that undertakes juvenile stapedectomy has to be prepared to do a drill out, as the disease appears to be much more severe. Similar to many other disease processes, juvenile otosclerotic has much greater incidence of obliterated foot plates.
I think it's about 37 to 40%.
Yeah, it's fairly significant, whereas in our adults it's been ranging 6 to 10% over the last 10 to 20 years. The technique is the same. We use the same prosthesis, which is a 4mm Robinson, which suffices in the great majority of cases, with a vein graft. We do intraoperative audiometry in those children over 12 years of age to verify objective improvement during the time of surgery.
We know that the longer we wait in these fast-growing foot plates, the more obliterative otosclerosis there's going to be. So we would tend to do the child earlier. On the other hand, you want to wait a little more until the child is more mature and can tend for himself and care for himself after the surgery. But in general, as you stated, the juvenile does as well as the adult. They should be done, be prepared for a drill out in 37 to 40% of the cases, but your results are going to be pretty good.
Thank you for joining us on discussion of juvenile stapedectomy.